Hello, my name is Dr. Anne-Marie Tang, and I'm from the Rubino OBGYN group. We're here today to discuss another segment of Ask Your Doctors. So, you've decided to have an IUD placed. You may be asking, what is an IUD? What can I benefit from it? So an IUD is a long-term form of contraception. It's good for 3, 5, 10 years, depending on which one you choose. So it's an excellent form of a way to prevent pregnancies, and luckily the 3 and the 5-year one also help with periods. So you can have very light periods with them, less cramping with periods, or even no periods at all. So in terms of an IUD insertion, we have you come into the office, we have you fill out a consent form, we make sure that you're not pregnant, and then we set up for the IUD. So it's like a pap smear in the sense that you have your feet in the foot holders, we bring you down to the edge of the table. Then we use an ultrasound probe to make sure we identify your uterus, and we have a good direction as to where to go. Then we use a cleaning solution called betadine. It helps to clean out any kind of infection that could be happening. So when we place something inside your uterus, we want to make sure that it's very clean. Then we use an instrument called a uterine sound. So it looks like a very long rod. It's a ruler, and it helps us to measure how deep your cavity is in terms of the inside of the uterus. Then we take out the uterine sound. If there's any problems with getting the uterine sound inside the uterus, we may put an instrument called a tenaculum to help hold the uterus and the cervix in place. And also we may use a dilator as well to open up the canal of the cervix. So once we're able to measure the inside of your uterus, then we place a very long rod inside the uterus. I'm going to show it to you. So this is the device. So we place this inside the uterus, and then we open up your IUD. So it looks like a T-shaped device, looks like this, and it sits inside the uterus, and then we take out the rod. It's attached to a string, and then we cut the string. So if at any time you do want the IUD removed, we just pull on the string and we pull out the IUD because it's all connected. After that, we take out all the instruments, and then we do one final ultrasound to make sure the IUD is at the top of the uterus. And then that's it. We do ask if you can take a Motrin or Advil before you come into the office because you may have some cramping with the procedure. And then we also ask that you come back in 1 month to make sure it's in the right spot. For more Ask Your Doctor segments, please look at our ROG Facebook page, YouTube channel, or website.